Is it good?
It's good.
I'm thinking street rice over here.
No. Turn it down. Before I grip your uterus. Will it grow back? Can we get another one?
All right. Ready?
Action.
Vaginal speculum, used for doing PAPs, pelvics. Sometimes even we will use this on a male to go in the anal canal if we need to open it up wide, if there's something stuck in there. So this will open up to this extent inside the female. We go in this way to get whatever it is we need. This is a biopsy. We would pinch down on it and pull it out. So this is a vaginal speculum. They're made of plastic now, so they are disposable, cuts down on infection. ACE wrap, also known as an elastic wrap, also known as ACE bandage. So ACE bandage, wrap, elastic bandage, all the same thing. This is used for usually joints to support, but please always remember never to stretch it. Staple remover. If you notice on the bottom, there are two little teeth. Those two teeth go under the staple. You press down, you bend the staple so that it comes up, and you unhook each side. Done correctly, it doesn't hurt the patient. Cervical punch biopsy. If you look in the end of this, it's got a little cup. It will cut off a piece of the flesh and you pull it out. That piece of flesh you put in a container and it is sent to the lab. Very similar to the alligator forceps, except this is a biopsy. You have the percussion hammer with sensation testers. In the top is your sharp tester, and in the bottom is your soft tester. It's a little brush. That gives us an idea of whether the patient has a neurological problem or not. This tests the reflexes, but we also have the sensation testers too. The same sort of thing, but without sharp and soft. So no reflex, no sensation testers, just the reflex hammer. Usually you use this on smaller joints and this on the knee or ankle. Stapler, this automatically staples, it holds 35. As they go along, they staple whatever it is that they're stapling. Usually skull now, they staple the skull all the time. But it makes it less traumatic for your patient. These are sterile applicators. They look like toothpicks with a long handle. Not toothpicks, Q-tips with a long handle. However, when you come to your instruments, please read what it says on it. Sterile applicator. Wow. Does it tell you what it is? This is what?
Determines the ROM, right? Range of motion.
What is it?
I don't know what it's called, but it determines your range of motion.
Goniometer?
Goniometer, yeah. And this tells us range of motion on a joint. And if you look on it, it does the knee, it does the elbow, it does the foot, and it does the underneath of the knee. So if a patient has had a knee surgery or something like that, what they have to do is get the range of motion back so they have full range. All right, so this is what they use. Goniometer. Done.
Action.
Rochester Ochsner comes straight and curved. Probably the largest hemostat that you will use. Very traumatic. When it pinches the tissue, it will not let go. It's got teeth, both sides. Plus, it's got mouse tooth at the end. So when this goes, it it clamps really tight. The same with the curved one, the mouse tooth at the end, the row of teeth down either side, and it clamps really hard. So they're the largest hemostat. The next ones are the Kelly, are the next smallest ones. You've got curved and straight. So these are Kelly hemostats. See the difference in the size. All right. So the Kellys are sturdy, but they're not as sturdy as the Rochester Ochsner. And curved the same. Always has that curve on the instrument. Then we have operating scissors, blunt, sharp, sharp, sharp. So there is a blunt, blunt, where both blades are placed with this D. So we have sharp, 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 and blunt, blunt. So there are 3 different types. These also can come curved. So the scissors will curve. I don't have them. But these are operating scissors. Then we have the needle holder. The needle holder is a very much smaller blade, and it has ridges on the inside of the blade. Once this is clamped down on the blade, at the needle, then we can sew with it, and we just let go of it once it's through. So this is a needle holder. Nail nippers, just to clip toenails. And you have to make sure that whoever's toenails you're clipping, you don't clip skin. So you have to be very careful when you use these. Then we have iris. There's a curve. We did the curve already. So these are iris straight. Again, sharp, sharp, and they're used basically for cutting suture and tissue. The Metzenbaum scissors, probably the most important scissors to let the doctor know. Both tips are round. If you look at them, both tips are round. To cut tissue only. Long-handled, short blade, because it goes into a wound and cuts around a cyst, okay? Most of the time they're curved. We don't usually use straight. Blade handle, this is the safety, and the blade goes on here, and then we would close it, and that's how we would use the scalpel. On the handle is measurements. This is how they measure how long a wound is that they have cut. Towel clamps. Towel clamp is for a towel like this. You clamp it on the towel and you turn it under, and it will hold the towel in place. But very dangerous also, very sharp on the edges. Be careful your finger's not under there when you go to clamp. I've seen it happen.